This podcast is made possible thanks to the generous support of Association Member Benefits Advisors. AMBA, formerly Mercer Association, helps support the practice of medicine by offering best-in-class insurance plans such as workers' compensation, life and disability that meet the needs of physicians, your families, and practices. AMBA is LACMA's sponsored insurance broker and administrator, supporting LACMA members for more than 25 years.
Welcome to Clear as Mud. I'm Dr. Omer Deen, president of the LA County Medical Association. Thank you for joining us. We are here at the Healthcare Burnout Symposium at the Luskin Center at UCLA. My guests today are Dr. Panos Sechopoulos, who is CMO of HealthBooks Plus, and Chris Turner, who's CEO of HealthBooks Plus. So we're going to have a little conversation today. Thank you guys for joining us and for being here with us today.
Yeah, thanks for having us. This is a phenomenal event that we've got going here at this Burnout Symposium.
It's been great. It's been eye-opening, and the things that we're hearing and the people that we're able to meet, I've made so many friends here today. It's been fantastic. So just some kind of, it's early in the day, but what are some of the key takeaways that you're feeling like that really resonate with you?
Boy, I tell you, from my perspective, it's been so interesting watching how engaging the group of physicians are that have attended this symposium. And they're not just talking about their practices and, their kids and the typical things. They're really trying to put their heads together and solve this physician burnout challenge. Some interesting things that I heard some people talking about is like, hey, how can we change just the layout of our practice office so that we can improve efficiencies amongst our staff so that would give me back as a physician more time. So I thought that was pretty fascinating. And, the brainstorming going on and just really the collaboration is just really pretty phenomenal.
Yeah, I thought so too. Actually, while you were speaking, one thing that I came to mind that I thought was fascinating is that they were talking about how social interactions and how that closeness and the bonds that form between us significantly reduce stress, and we're able to cope with a lot more, get a lot more done, and we have an overall pleasant feeling about our workday. And so a lot of what you just mentioned, one of those things is structuring your office in a way that promotes social interaction rather than isolating people to their cubby holes and kind of doing it that way. Allow that interaction, that socializing, the very things that you would initially think like, the people aren't going to do any work because they're going to be busy.
Right.
It's actually the reverse. They get more done and they're more creative and they enjoy their work. So I think things like that are just, for me, takeaways that I think we're going to go back and we're going to reassess.
Yeah, and Dr. Dean, think about it. Most offices are set up with the doctor's office in the corner down the hall, the MAs all together in a group in the middle, and then the patient rooms all along the sides. And just think about, what if you put the doctor and the MAs that physician works with together sitting next to each other like this? Imagine how much more efficient that would be versus the messaging that you keep sending back and forth because the doctor's at one end of the corner and the MA's in the middle. So little things like that can give providers back a ton of time.
So I will plug my office. We have an urgent care that we just opened in an infusion center, and that was key to the design, was to build a central command. I call it central command, where everybody's in one spot together, and then the patient rooms are around that. And we're already finding that is so much more helpful for people, just the flow of things and to interact, and you don't have to no one's isolated away. So that's fantastic.
Yeah, and Dr. Sechopoulos, I know you have a pretty interesting setup in your clinic.
We do, and thank you for having us. It has been a great experience so far, and as a physician, it's always good to connect with other physicians and talk about ways that you can solve this problem, and just the support that you feel, and the fact that there's other people where you are, your immediate colleagues are, but everyone is on the same boat, and we are doing many things to help that. The circular idea about an office has always been a big thing with me. So we are both digestive disease doctors, and our endoscopy lab is set exactly in that way.
Interesting.
It's a circular endoscopy unit, not only for the patient as they come in, they go through the process and then out, pretty much the same door, but after they go through a circle. And all the doctors and the nurses are in the center. So we're always there one with each other and with the patient. So we find that has created an amazing bond, and we're there to help each other out. So that's just one thing we've done instinctively, but I'm glad to hear that it's been also done elsewhere, and it works.
Wow, that's wonderful. So going back to that, I think that's a really good point. And one of the things that we share in common is our specialty, and so we're discussing that a lot. Talk shop a lot, of course. People are nervous when they come in to see. Generally, people are nervous when they go in to see their doctor, but when you go in to see a gastroenterologist, you're extra nervous, right?
Right.
And so, how do you put people at ease? And if patients are really stressed out and anxious, the staff is stressed out and anxious. And that's a perfect setup for mistakes and errors, medical errors and things like that. So it's really even more important to have good flow, good communication, a calm atmosphere. And it sounds like you've got that. So what are some of the things that you're finding are going to be the most useful when you go back? What are something, like just one thing maybe that's new that you hadn't thought of before you came to the conference?
So I'll tell you, one of the things that's been really revolutionary, I wouldn't say revolutionary, but it's common sense, but I haven't thought about it, is medicine really has become very transactional. And that transactional component leads to a lot of things, and I think not as good of care as it was when it was relationship-based. And one of the things that a big stat that I always quote all the time is 1 in 20 people in the U.S. will have a misdiagnosis that leads to major morbidity or mortality, and that's like mind-blowing. 1 in 20, right? And the number one reason for that is fragmented care. And so what that means is that that relationship isn't there anymore. So now we're transactional. So providers make the best decision they can based on the data that they have, which can have a lot of holes.
Absolutely.
And so that's one of the things that we at HealthBook Plus want to try to help solve. How do we fill some of those holes? But coming out of this conference, I think that relationship component is really powerful. One of the speakers was up there talking about, if a patient, for example, she calls up to make an appointment with her doctor because she has a particular issue that day. The office staff's like, hey, you know what? Dr. Sally's not available, but Dr. Jim is available, could get you in. Okay, great. Well, a health system is going to think that's a success, right? We got a same-day appointment.
Right.
Everybody thinks that's success, but then you start breaking that down, right? The patient goes and sees the doctor she's not familiar with. Then the doctor has to try to get familiar with all of the complex conditions this patient has. And now instead of it being a quick 10-minute visit that it could have been if she saw Dr. Sally, her regular doctor, now with Dr. Jim, it ends up taking him 20, 25 minutes and then an extra 45 minutes to document everything and do a bunch of additional tests that he didn't know were run in the past and things like that. So it just becomes much less efficient and ultimately burning a lot more physician time than we really need to versus if it was relationship-based versus transactional.
That's absolutely true. And that's actually a perfect segue because I wanted to hear a little bit more, and I wanted our listeners to hear a little bit more about HealthBooks Plus. So maybe just a brief kind of what are you...
Yeah, sure.
Tell people about that.
No, we're super excited because what we've built is an early identification and guided health platform that leverages data to help people understand their next best health action. And so as part of that, we help providers with consent of our owners to have all of the data and the health history that individual has, and they can share it with you as a provider. And you get to see everything in a very organized, categorized way.
That's fantastic. And then there's it's first of all, it's on your device, so it's with you at all times. And you can grant access to providers, relatives, anyone you want, really.
That's right.
And there's a snapshot of your entire health history. So, God forbid, an emergency situation, you could look at this and you could say, okay, this is a diabetic, they've had coronary disease, they've got this, and they've already been treated for this. It gives you a quick synopsis of what that patient is dealing with. And so you don't have to deal with that, the stack of records that we're so used to seeing, where there's maybe 1 or 2 pages of useful information, but you have to sift through it. And it takes a lot of man hours to do that.
That's right.
That's fantastic. That's fantastic.
And then we even add some AI on top of that helps the owner really understand when they need to go to the doctor. So whether it's a pure preventative nature, like, hey, you may have an issue with cancer in 10 years because of family history, genetics, different components of the data we bring in, or it could be something that's really more acute and you need an instant health check. you can walk through the platform and it'll give a preliminary diagnosis and a direction to what type of provider to see and what modality, whether you need to do that through an urgent care setting or you can just do telemedicine.
That's excellent.
So from the owner, the user standpoint, it's very beneficial, but it's also very beneficial to the MD, the provider, because they will be able to have the whole record in one place. So they won't be concerned that the part of the record is at a different EMR and they're missing out on some critical information. That will help them in providing better care if they have access to the whole record rather than the part that's on the same EMR that they're on. And also, they will have the ability to leverage the AI-provided guidance that HealthBook gives in order to make their appointment with the patient much more efficient, because they'll have a direction and a tool that they can use to make however much time they have with the patient very interactive and very useful, instead of trying to figure out, these records, look through them, and waste valuable time. So HealthBook Plus can help the physician be more efficient, reduce their burnout and their frustration with the time limitations on how seeing patients.
This is a huge source of burnout for us, is extracting this information, trying to gather it, multiple different EMRs, filling out forms, trying to get this information. It frequently takes weeks to build up to an appointment to be able to get records in time.
Right.
The things that jump out to me are, number one, the communication between multiple EMRs, electronic medical record systems, which is huge. Second, I'm thinking about like code status and those types of discussions, rather than the healthcare provider obtaining that information during an emergent situation or when someone is sick and hospitalized. This is something that can be addressed and is already decided on, goals of care, directives. And so that's really, really helpful.
There is a health vault that all these health-related documents are there always for the user or their provider to access.
Right. Well, I'm excited to start using it, and I'm going to start it for myself and my family. So thank you, guys. It's fascinating with HealthBooks Plus how you've been able to integrate an entire medical record, but also you've been able to address some issues that we complain about as providers with regards to burnout. So if you could go into that a little bit about how you've addressed that.
Right. Thank you. So as Chris mentioned, we aggregate all related data, all health data from everywhere that is available. And then our predictive analytic models that we have, especially when it comes to depression and mental health decline, is able to provide early messaging about the potential of decline in the horizon for the user. So when that message appears, the physician, who is now the owner of HealthBook, and the user can, through the same platform, in a very private and secure way, access the help that is needed. So reacting to the message that they receive in a private way, they also our platform enables the next action, the next best health action, which is a meeting with a therapist, with a peer coach or a psychiatrist. And all that is done in a very private way, avoiding any concerns about stigma or any other negative association with
that information is kept private.
Right.
And that's really important, that you own your own data and your own information, and only you can decide who to share it with or not share it with.
Exactly. And nobody has access, and nobody looks at the data or any part of it.
That's fantastic. Many of my colleagues have brought that up as an issue, that if they're feeling stressed or anxious and they feel like they could talk to somebody, they're afraid to do so because of the repercussions, because their employer would know, or that it will be on their insurance. And then sometimes their own liability or malpractice insurance or life insurance is impacted by that. And so what's really important is that this is all confidential, which is fantastic.
Right. And I've had colleagues like that who told me that we get emails, are you feeling down, from their employer in an attempt to help with the issue. However, they told me that we don't even answer those emails. We don't even open them, because if we open them, they might assume that we have a mental health issue. So it all goes nowhere.
Right.
And ultimately, what matters is for the physician to get the help they need. And if they're deleting the email without even opening it, how can they get the help they need?
Absolutely.
But so HealthBook came to solve that problem as far as physicians and healthcare professionals in general to face this epidemic now, which is the mental health.
I think it's fantastic,
decline.
and I think the value of this is just huge, and how fitting at the Healthcare Burnout Symposium that we're able to have this discussion. And so, just in kind of conclusion, I think the relationship between HealthBook Plus and LACMA is something that I think we got to nurture, and there's more things that we can do together.
No, for sure, Dr. Deen. And we're really excited. And we've set some things up with you and Gustavo. So we're going to be doing some webinars in the future, probably a town hall. And, the other thing we're throwing out here is we're so committed to helping providers get their mental health, is we want to make sure that we give all LACMA members free access to HealthBook Plus for themselves and their family, so that we can help with the burnout any little way that we can.
That's fantastic. Thank you for that. It's a
Absolutely.
pleasure speaking with you both. Thank you for the podcast. And that's our episode of Clear as Mud. So thank you again, and please join us for the next one.